So we're going to start off going over the muscles of the pelvic region. We're also going to talk about the blood vessels and nerves that are going to be associated here. So here we start off here in the front area here. And we have, of course, this muscle right here, which is the iliacus. We also have here the psoas muscles, the major and the minor. So here's the psoas major, here's the psoas minor, and these are coming down, and they're going to then join with the iliacus, and they're going to end up forming the iliopsoas, which is this muscle right here. Now, before that happens, it crosses over this ligamentous tissue right here, which is going to be the inguinal ligament. Okay, so that's what you'll see here. Now, off to the side of this, coming down here, is the common iliac artery, which then turns into the external iliac artery here and the internal iliac artery here. The external iliac artery will then, after passing the inguinal ligament, form what's called the femoral artery, which is here. So we'll talk about that in the next video. Here we have the external iliac vein as well, and we're going to move in and we're going to see some of these muscles here. Now, this muscle right here is the coccygeus. Okay, the one next to it right here is called the iliococcygeus, and then this one is called the pubococcygeus. Now, the reason this is called the iliococcygeus is it's coming from the ilium. Okay, whereas this one is called the pubococcygeus because it's coming from the pubic. Okay, so that's why. Now, these two muscles plus one other muscle, actually all of these in general, are going to be a part of what is called the levator ani. It elevates the anus. That's why it's called the levator ani. Now, this other muscle right here, back here, in the back here, that's called the piriformis. So the piriformis starts off here, but then it comes over and comes out right here. And that again is the piriformis. We'll come back to that in a second. Now, you do need to be able to identify, obviously, here we have sacral nerves, but I do want you to know this particular blood vessel and nerve, and this is the obturator, artery and obturator nerve, because it's going to go in and go through that obturator foramen, which I had mentioned earlier, associated with the pelvic, or not pelvic, but the oxcox, so basically the pelvis bone. Now, let's turn this over here a little bit. Now, on the back side, you'll start off seeing this larger muscle kind of coming over and covering everything. And this is that large muscle called the gluteus maximus. It has been cut away, so you don't see it right now. Underneath that, we would then have this muscle right here, which would be the gluteus medius. And then below the gluteus medius would then be the gluteus minimus, but we don't see the gluteus minimus because it's still covered up by the gluteus medius. Below that, we of course have this, which of course is the piriformis, which I already discussed. And then you'll see here this sciatic nerve coming out. As it's coming out from the back, there it is, coming out. Now, underneath the sciatic nerve, we actually have three muscles here, and then this fourth muscle that I want to talk about. First two muscles that I want to talk about are these two right here. These are called the gemellus. Now, the first one is the superior gemellus, and the second one here is the inferior gemellus. Now, here's the thing. There's another muscle in between the two gemellus. This muscle is called the obturator internus. So that's this one right here. So it's gemellus, internus, gemellus. So remember that, because if I pin here, don't tell me that that's the inferior gemellus, because it's not. It's the obturator internus. Now, as we move down here, we get to this point right here, this rectangular muscle, and this rectangular muscle is actually what's called the quadratus femoris, as opposed to the quadratus, the pronator quadratus, or the, and here this is actually the quadratus femoris, which is a kind of rectangular muscle associated with the femoral region. Okay, now right in this area here, we have this little blood vessel right here going around the femur. Remember in the arm that you had an anterior and a posterior circumflex. In this case, what we have is a medial and lateral circumflex, and so you can see here, this is more towards the lateral side here. Okay,